Welcome. Today I talked to Dr. Ramondetta, and she is a full professor at the University of Texas, the MD Anderson Cancer Center. And she works with gynecologic oncology and reproductive medicine, and she provides surgical and chemotherapy directed care. So, the really amazing thing about Lois, as she asks us to call her, is that she is also a certified yoga therapist. And she has used yoga therapy not only in her own life to overcome burnout as a physician and to reduce her own suffering while watching her clients and patients who sometimes don't have great outcomes. And she has really used yoga philosophy to help herself through those difficult times, and then also possibly sharing some of those ideas with her clients. So in this interview, we talk about how she's used yoga philosophy to kind of overcome burnout. And then, of course, many of the tools of yoga, the breathing, the postures, the meditation have also been of great help to both she and her clients. And she's also working with a team to use research to study how these things like reducing stress, eating better, sleeping better will help people in their cancer recovery. So that whole idea of lifestyle medicine and how it really does matter to outcomes. I think you're really going to enjoy my talk with Lois, and she's just a very humble, sweet, kind person, which you don't always find when you have such a high level of education. Sometimes there's a disconnect there, but she really is the whole package, and she understands the heart of yoga, the heart of yoga therapy, and the heart of being an amazing doctor. I think all of us, after listening to this episode, will agree that this is the kind of doctor we are looking for. So let's go meet our guest today. Welcome to the Yoga Therapy Hour, Season 7. We are so happy that you've been here on the journey with us for almost 2 years now, and we're looking at over 130,000 downloads. It has been a wonderful run together, and we are going to continue to provide excellent content. And this season, we want to go into the depths of the human experience and the human heart. So stay tuned. We're going to continue this journey together, and we look forward to seeing you for all of Season 7. It's such an honor to host you here today, Dr. Ramondetta. Thank you for being with us.
Amy, I'm really excited to be here and talk with you today, and please call me Lois.
Okay, thank you. So you are an oncology doctor and at MD Anderson, and you work, is it primarily with ovarian cancer or all sorts of reproductive cancers?
All reproductive cancers, and that's kind of anything between the belly button and the pelvic floor. So ovary, uterus, cervix, vaginal, vulvar, a couple of more rare ones, but that's our specialty. We do chemotherapy and surgery for those patients.
Wow. And MD Anderson has really been ahead of most other hospitals and hospital systems in the United States because you have a real integrative medicine focus and yoga program. Can you tell us a little bit about that?
Yeah, actually through two amazing leaders, Gabriel Lopez and Lorenzo Cohen, they have really integrative medicine into our patients' opportunities. We have a great acupuncture program, massage program, but we do have a wonderful yoga program. Smitha Malaya is the main yoga therapist, and we do a lot of research. Lorenzo has published quite a bit in this area. We have just finished accruing to a protocol I'm working with both of them on. And then we offer some free programs. So Monday, Wednesday, Friday, we have a free yoga group class. We offer yoga nidra twice a month, and then pranayama also twice a month.
And were they doing all of that before you came, or were you part of developing that? How did that happen?
No, I'm lucky to be a part of it. This was all Smith and Lorenzo Cohen. Smitha Malaya and Lorenzo Cohen initiated all of these with the partnership of Gabe Lopez. And I am a full-time GYN oncologist at MD Anderson. This is my 27th year there. And I found yoga for myself. I actually needed to find yoga for myself in order to not be burnt out somewhere mid-career, and learned first the physical and then moved into the philosophical areas, and now try to add little tidbits to my trainees and my patients as I go through. And I volunteered to teach the Friday class and one yoga nidra a month. So bringing yoga is through lectures and then little tidbits for my patients that I think will help them, primarily breath work. And the highlight of my week is teaching that class.
That's amazing. I think it's really important because when someone with your credentials says, this is important for you to do, this is going to help you, it has a whole different meaning than, some of us out there without those kind of credentials. Like, people listen to their doctors. And if a doctor is saying this is an important part of your healing, chances are they're going to believe that.
I'd like to say they don't always listen to their doctors. I'm finding that doctors could have definitely learned a lot more motivational interviewing, and perhaps parents of teenagers as well. But the truth is if people don't want to do it, they won't do it. But continuing to mention, we all get siloed into either above the neck, thinking about how people think about things and forgetting about their physical body, or thinking about addressing their cancer in a reactive kind of way. How do we deal with these new findings on this CT? And we learn a lot of communication skills, but we don't do a lot of teaching about how to help people negotiate their circumstances, whether it's me negotiating my circumstances or helping a patient negotiate. And I feel that yoga therapy or yoga philosophy, learning some of that, has given me tools that I didn't learn in medical school. And learning even specifically about the koshas has given me a whole new way of looking at patients that has brought me back to the awe of medicine that originally brought me in this direction.
So for some of our listeners, let's just very briefly break down what you mean by the koshas. Do you want me to quickly do that, or do you want to take a shot at that?
I'll take a shot at it, and then you can correct me.
Correct you. I'm sure you have it down.
So I feel like I learned a lot about the Annamaya kosha in medical school. I learned about how the physical body works. What are some of the interactions? How do you treat diabetes? How do you deal with somebody who sprains their ankle? Those kind of things. And then I think subtly we might pay attention to the pranamaya kosha, but to really think about perhaps the energy of the physiology, that might be one way of thinking about it. How the Krebs cycle works, how the glucose cycle works might be one way of thinking about it, but could also be the energy the person brings into the room. It could be the way a person approaches their particular illness. And it might even be a little dosha oriented for me, in that looking even perhaps at my two kids are very different energies in the way they approach their issues. The Manomaya kosha, I think we learn about in terms of books, the mind, the way somebody processes the information that comes to them. The Jnanamaya kosha, where you have kind of a basic philosophy of life that you approach, that kind of influences the way the Manomaya kosha takes information in, and perhaps maybe where you might be willing to receive other areas of intellect, maybe religion or philosophy or something that could really influence that. It could also be that person, if you're lucky enough, in my mind, to step back and say, oh, I look at that person who continuously suffers when perhaps the doctor is taking too long to get in the room. And rather than being that Manomaya kosha person, you can say, I see them, I see their suffering, and it's really not that big of a deal. We can kind of step back. And then obviously the Anandamaya kosha, which I would love to say that I access more than just for those minutes in Shavasana at the end of a yoga class, but I feel it, and something that connects to the meaning of your life and where you find true happiness. Yeah. That's my 5 ideas of the 5 sheets of being.
So like the thought of a doctor walking in, you've received a cancer diagnosis, your doctor walks in to give you care. If I had a doctor that knew that and acknowledged that and saw me as a whole person, like that would be Amazing. Amazing. I'm feeling a little envious of your your patients. When I went through my cancer diagnosis in 2022, I asked my doctor, is what I'm eating, how much does that affect my healing? And the answer was zero. It does not affect at all. And I said, are you sure? Like, doesn't sugar feed cancer? There's no proof of sugar feeding cancer. I've read the research. I know there's something there. Can you talk about that a little bit? Because it's surprising when doctors take that approach.
So I'm definitely a food is medicine approach. That's definitely one of the first things I talk about with patients is what they're eating. I would like to say I wish the data was stronger. And I think that both with yoga data and food data, there's just so many variables. Yeah. It is really hard to capture that. I always fall back on everything in moderation. And though I truly believe that eating a rainbow, eating yellow, orange, deep green, incorporating all of the healing herbs like turmeric, cumin, garlic. I'm trying to think of what else I'm leaving out.
Ginger.
Ginger, for sure. I've got my tea right here. Is important. And that, let me say it in a way that I think medical society has gotten a little bit closer to an answer, is that inflammatory body constitutions are definitely not healthy and can lead to obesity and reproductive abnormalities. And how we actually get a handle on that once those things have happened is pretty hard. It is definitely more important in prevention. In certain cancers, it's very good data, specifically breast cancer. And we know that there are at least 13 cancers related to obesity. And so I would say, I can't specifically say sugar is bad. I will say that I think eating preserved foods, a non-plant-based diet, and too much sugar is not good. Not good maybe for cancer, definitely not for your heart. And that is probably the bigger killer of all people anyway. I don't know if that helped, but it is a hard thing to study.
Yeah. I mean, the thing that I went to, and I didn't say this to the doctor, but before you get a lot of these medical tests where they're putting you in the tube to see if they can find cancer, they tell you not to eat sugar.
Because PET scan specifically.
Yes. Yeah. So to me, like, okay, if I eat sugar and it shows up on the PET scan, there's maybe a connection there.
A little bit. The reason for PET scans and sugar is more because it's looking for metabolically active cells. And it's almost like you see some normal cells that are more metabolically active. If you eat a lot of sugar, they'll be processing that and you may get a false positive. So that's the main reason for it in PET scans. It's not necessarily that you're feeding it. And I always tell patients, I have had patients who say, I'm not eating any sugar, not for the rest. I'm only eating plants, no more meat. And you can actually do some damage that way. Also, we don't want patients to lose a significant amount of weight during their treatment. We wouldn't mind them shifting to a healthier weight very slowly, but we definitely like their protein levels to stay high and to avoid a non-beneficial diet. So I hope that helps a little.
Yeah, it's great.
I think that you can also affect your immune system by not getting your vitamins through your food, not through supplements. And we're pretty careful to stay away from supplements in that the data really just isn't there for most supplements. I think the only supplement we regularly recommend is vitamin D if you're low, and to try to get everything else from your food.
But we're going down a little food alley here, but I just have one more question, then we'll get back to you as a cancer doctor. So you just said we should try to get our vitamins from the food, but isn't there a lot of truth to the fact that our food is actually lacking the nutrients compared to in the past?
I don't think I'm going to be able to comment on those things. So I would say in terms of fresh fruits, vegetables, not that I'm aware of.
Okay. See, I love this. I love talking to a knowledgeable person who actually, worked with this all day.
But is the stuff that we buy in the grocery store probably lacking in nutrients? Yeah. And one of the major nutrients a lot of our stuff is lacking in is fiber, which is one of the most important things for keeping our microbiome healthy, which is so important throughout cancer treatment. And we're learning more and more about that, especially in patients getting immunotherapy, that it is really important to have a healthy microbiome. How do you do that? You get fiber, which means really aiming for like 20 to 30 grams minimum a day of fiber. And so it's hard. So if you think an apple is like 4 grams, you'd have to, and I'm not saying anyone should eat 5 apples a day, but you'd have to eat essentially 5 apples with the skin on it to get to 20.
It's really hard.
It's very
hard. Everybody go out and join your local CSA, community supported agriculture.
Yeah. And when you buy something in the store, turn it over, look at the label. And if there's no fiber in it, like breads that have no fiber, try to make a slight switch.
Yeah. I just had my Ezekiel bread this morning. So,
oh, yeah. Great one.
All right. So the other area that you offered to talk about today was as a caregiver, whether that's a nurse or a doctor or, a physician assistant. You had talked about how when you started to go into burnout, you came to yoga, and that's kind of was your step into it. And now you're a certified yoga therapist. But let's talk about that a little bit, about our medical professionals and the burnout that they're experiencing.
Yeah, it's a tough world to work in right now, especially since COVID. I think that there was definitely a group of people that left medicine. We function sometimes on slightly lower resources in terms of people resources. The requirements are high. For instance, the amount of time that you can see a patient and the number of patients that you're supposed to see in a clinic, it seems to, the amount of time you can see a patient in goes down. The number of patients you're supposed to see goes up. All of that definitely weighs on caregivers. For me, and that's probably where I'm most comfortable speaking, is I think what really helped me in terms of yogic philosophy was putting a name to what was causing my suffering, like to actually understand, to start to develop a pause before causing my own suffering by having things come out of my mouth inappropriately or reacting quickly, to be able to start to find a pause between my initial thoughts about, I really want this patient's cancer not to have responded this way. Or I really wonder, could somebody else do this better than me? Could they help her live longer? Or something like that, where you're really starting to say, it's what I want, it's what I don't want. It is this clinging to life, whether it's my patient clinging to life or me clinging to her life. And then, as we talked about briefly, maybe right before this, is like how I identify myself and being caught up in your success as the way you define yourself. And so those things were really weighing on me mid-career. They still do now. I usually call myself a wannabe yogi. I'm in the process, but I think that those things are important for patients as well. And the only way, just like the Yoga Sutras say, the only way to recognize those things that are causing suffering is to pause and to find some way to pause. How do you switch? And that's where I feel like I can benefit patients, is helping them recognize that they can shift their reaction to a parasympathetic relaxation, or at least quieting, so that they can maybe at least see that those are the things that are going on right now, and to try to separate themselves from them so that they can see what it is that they're really after.
So you're saying that on 2 levels, though. You're saying that you yourself are learning to take that pause and come into parasympathetic and do some self-reflection, which I want to go back to all of that. And you can also help your patient take a pause, take a breath, do some self-reflection. And I think I heard you just talking about were the 5 kleshas, your attachment to them getting a good outcome, your aversion to them maybe passing or having lifelong disability, your identification as a good doctor who is doing her job well. And if she does her job well, then they have to live a happy life forever after. Am I hearing that right?
Yeah. For sure. I mean, I think that was one of the most important aspects of the philosophy that was helpful to me, is that recognizing what was causing my suffering is the first step. It doesn't mean I have conquered them. They come up all the time, but recognizing those things, and then recognizing that that was the case for my patients as well. And I mean, of course, everybody wants to cling to their life. And that's the hardest thing in what we do. Specifically, ovarian cancer is a difficult one.
Yeah.
There are a few that go away and never come back. But for the most part, it is a lifelong struggle where each step of the way, you are deciding between another medication that has a slightly less efficacy than the one before, a slightly shorter duration of response than the one before. And you have to help people kind of transition to say, we've gotten to a point that more is not better. More treatment is not better. And each time there are so many dynamics going on to the, I want this, I don't want this, I wish this wasn't happening, I wish this was happening. And for me too.
Yeah. And, that's such a natural, empathetic human response. I mean, that's, as you've talked about, why you went into this career, to be of service and to help people. And then to learn, like, oh, I have to detach from the actual outcome of this, both you and the patient. That's rough.
It's detachment, but it's also just shifting. It's shifting to, God, if you can have somebody have a good death, that's pretty powerful. And if you are clinging to what, or even averting from what you don't want, or clinging to what you want, you actually cause your own suffering. And to some extent, and I say this carefully because I'm not blaming anybody. It's really hard to do these things, but the gift that happens when somebody passes with peace of mind is so powerful for them and for their loved ones.
Yeah, there's probably some peace that comes with that, and closure, and a life well lived. And we've said all the things we need to say before we don't have a chance to anymore.
Yes. And if you're clinging, you miss that chance.
And by clinging, you mean, what's the next treatment? And how am I going to get better? And when am I going to get out of here? And when are we going to go back to normal?
Yes, exactly. And though, even for the people who recognize it, so I'll give an example of someone that I'm thinking about right now. She and her husband definitely know that they want to at some point, want to shift to spending quality time together and not stay in this business of treatment. And finding that right moment is so hard for me and for them. So if you say, for instance, we have this drug and it's got about a 20% chance of working. So 2 in 10 people will respond for a short period of time. Walking away from that is really hard.
Those extra few months together, if it could work, as opposed to, we're going to go home and enjoy each other for as long as we possibly can. And not be getting pricked and prodded and tested and wondering and eating. And
it's really hard. And the easiest times are when the patient is so sure of themselves that they come to you and say, thank you. I've had all that I want. It always makes me think of, I don't know if you're a Scrubs fan. Did you ever watch Scrubs?
No.
There's a wonderful episode where one of the main characters has a patient who needs dialysis. And he goes to her and he's like, I'm really sorry to tell you, but you need dialysis. And she said, no, thank you. And he's like, what? And she says, no, I've had a good life. I don't want that. And so he comes back to her with all of these, as a physician, all of these reasons why she should stay on this. And she said, did that. Why are you still here? Why aren't you out doing these things for yourself? So it's a struggle for both. And I think I told you I had a very good friend years ago who I met when I was a trainee, who was a patient of my chairman. So one of the things that happens when you're a trainee is that you round really early in the morning and you really get to meet the patients. And she was a beautiful woman who had ovarian cancer and also a world religions professor in California at Cal Lutheran. And she and I started talking about these topics. And it's interesting, we wrote a book together. It's called The Light Within. And the reason I'm mentioning her now is that she told me mid ovarian cancer that she wanted to keep a stash of morphine just for that time. And she said, you have to promise me that you're going to help me. But when the time came, when Deb died, she didn't want to do it. She definitely wanted Mozart playing as she died. She had the ideas, but she hung on to the end. And that happens to all of us. I mean, it's hard to let go.
So you're saying she didn't want to not be aware at those final moments. She wanted to be conscious and really feel what was happening inside of her.
Yes.
Wow. This is so powerful. When I was diagnosed, and it wasn't a life threatening cancer, but it could be a life changing cancer, especially if, at the beginning, you don't know if it has spread. There's many months where you're kind of waiting to see what stage it is. And I think because of the yoga philosophy, somehow I was just able to surrender immediately. I put things in line for my business, and then I went and pretty much enjoyed 4 months off. Didn't fret too much, felt pretty darn good, right? But I credit that to the teachings of yoga.
Yeah. And I think that your continuous practice for as many years as you've done that was the reason that you were able to stay in that.
You don't reach clients till they're there having surgery or chemo or radiation. So it's interesting to think. I know your study that you have been conducting and you're writing up, and I think you had some great data, is about like pre-surgery preparation. Is that right?
So we have two studies that one is completing, right? We just accrued the 40th patient. It's a pilot study. And, part of the idea with yoga, as you know, yoga has recently made it to the American Society of Clinical Oncology guidelines for things like anxiety and depression as fatigue, potentially some other areas, aromatase inhibitor, arthralgias. But the interesting thing about all that is when we say that, all it says in the guidelines is yoga, and it doesn't really say what that means. But as a scientist, I would say it probably means at least 3 components, right? It usually involves asanas, pranayama, and some amount of concentration or meditation.
Did you know that the Optimal State offers a 200-hour yoga teacher training completely online? There is work that is self-paced, and videos and audios and workbooks and flashcards and manuals that you can do self-paced. But then we also have a community that comes together every week for a question and answer, short lectures, a way to connect. So we hope that you'll join us for our 200-hour yoga teacher training. This is great for anyone who just wants to dip a toe into an advanced yoga teacher training, or maybe a healthcare provider that's thinking about becoming a yoga therapist, but due to the IAYT requirements, they need to have a 200-hour before they can go into a yoga therapy program. Now, one more thing, we offer our 200-hour yoga teacher training for free if you end up taking our yoga therapy program. That's how much we believe in it. So we hope you'll join us, whether you're taking it for your knowledge or whether you want to make a profession out of yoga teacher training or yoga therapy training. We'd love the opportunity to talk to you about it and see if Optimal State is a good match for you.
We really need to get better at defining what that is. And though the study that I did with cervix cancer patients that Lorenzo Cohen and I and Smith and Malaya are working on accrued people during a really difficult time. For cervical cancer, the treatment is about 25 daily treatments of radiation with weekly chemotherapy, followed by some internal radiation. And this is when the cancer is already a little locally advanced. It can be painful. There can be bleeding. My thought was, why aren't we incorporating some mindfulness as well as some stretching to the radiated areas and some kind of calming of the mind with this craziness happening around you for these patients? So that study accrued 20 and 20 in the patients who got yoga therapy twice a week guided, and then recommendations for home practice. And we looked at quality of life. We are looking at pain, fatigue, sleep, which has also been a nice, beautiful outcome in the past for yoga. And then also some immune modulators like interleukins and something called VEGF, which is called vascular endothelial growth factor, which is expressed by cervical cancer and kind of calls new nutrients to the cancer. Blocking that or seeing that go down would be a good thing. And so we don't have any data yet on that. We just accrued the final patient, but we were able to say so far that it looks like it was feasible. And then the one that we're launching now is looking at more of a comprehensive yoga therapy approach to prehabilitation for ovarian cancer patients. And so for ovarian cancer, we make a decision when we see a patient whether or not surgery up front, followed by chemotherapy versus chemotherapy to shrink the tumor, surgery, and then more chemotherapy afterwards is the best outcome, is the best for that patient. And it's really about their performance status when they show up. Like, how do they look? Are they going to be able to go through all of this? And, or are we going to be able to get all the tumor out? Because we need to be able to get all the tumor out if we're taking them. Yeah. So if we have somebody that we don't think we can get all the tumor out, or they're not physically fit enough, it's best to start with chemo. So that's about 3 or 4 cycles, about 3 weeks in between. And the idea is, what we're really dreaming about doing, and luckily we have a small amount of funds for this, is to look at a comprehensive yoga approach. So nutrition, sleep, stress, movement, hitting aerobic level. So we could think of either chair sun salutations or full sun salutations if the patient's able, as an aerobic method, or maybe even some loosening, matching breath to movement. So standing with your arms up and inhaling, exhaling, inhaling, exhaling. So a little kind of Bhastrika and leg movement at the same time. So all of those things with microbiome checks. We hope to launch that this year. It will also be a pilot study. This is difficult for a number of reasons. Patients are overwhelmed when they're first diagnosed. They are exhausted. So one thing that happens with ovarian cancer patients is they often have ascites, which is a fluid in their abdomen that can be cause a lot of distension and bloating. Movement can be difficult. Taking a deep breath can be difficult, but that usually responds very quickly to chemo. So luckily we have Smitha, who is a wonderful yoga therapist, who is going to dynamically change what these patients do as their cancer side effects go down and perhaps their treatment side effects go up. And that's a very hard thing to study.
It really is.
Compared to a drug study, say, where you're looking at, did the tumor shrink? What were the toxicities from the drug that we gave them? There's not a lot of subjectivity there, right? In comparison, let's say, although I don't know how this could be, that the person learning from Smitha doesn't like Smitha. Mm-hmm. Let's say that she says a word that triggers them the wrong way. Let's say that there was an odor in the room. And I always make this joke. I've made it a few times when people have asked me. I tend to sometimes really need a good Rajasic yoga class to get my energy out. I remember doing that, having this wonderful experience, lying down in Shavasana, ready to receive. And they put on Elvis Presley's song, Only Fools Rush In, which is a great song, except for it was my first marriage wedding song.
Oh.
It was gone like that. And I think that this is such a hard thing to study. And the thing that
lifestyle medicine,
Yeah, it's true. And though in my heart, practicing, learning, doing this for myself has been hugely helpful and allowed me to continue. So I know there's benefit there. Maybe not for everyone, but that was a long-winded response to what research I'm involved in right now.
Well, I think it's so important. I mean, even if we look at like the Alzheimer's research, there's a couple of different areas that are kind of going in this lifestyle medicine direction, saying that it's not going to be a pill or a medication that cures you, but that a common sense, healthy life can really support treatment as well as hopefully recovery. And to me, it doesn't seem like that should be controversial. We want them to get good sleep. We want them to move a little bit. We want them to eat fresh fruits and vegetables. We want them to reduce their stress. And I think we've seen a lot of this with Dean Ornish's work for heart health. We've seen it at UCLA with the Alzheimer's. So I don't think it's that unusual, but could we say that when you take this type of an approach for research, that it's hard to show causation? Is that really the difficult part of it? Because there's just, again, too many factors to know what's causing the positive outcomes.
Yeah, I think that's very true. And I think that's part of the issue with us putting yoga as a recommendation, because what are we really talking about? And a good example would be, we have something called a closing set bundle. So when we operate on somebody, if we enter the vagina or enter bowel, it's considered clean contaminated. And so to close, we actually have a second set of things. We take off our gowns and our gloves and we change them. We change the dressing around after we're ready to close around the patient. And then we have special instruments and a whole bunch of stuff goes into it. And it has shown to reduce the infection rate. That's why we do it. The infection rate in the skin. And everyone's like, well, do we really have to do all of those things? Do we really have to change our gowns and our gloves and re-drape the patient and do those things? And everyone's like, well, yeah, but we don't know which is the aspect of this that really helps. So let's just keep doing all of it. And that's kind of where we are with yoga in some extent, that we don't really know, do we need to do all those components? Do we need to do just breath, just concentration, just meditation, just physical? And there isn't really a prescription. I mean, one thing, and this might be controversial, what I'm going to say is that many of the mind body relaxation that is defined as like the John Kabat-Zinn work is, to me, simply yoga. That's where it might be controversial, but it is. It's somatically being aware. It's breath work awareness. It is gentle movement and bringing yourself outside or away from all of these things, closer, closer, closer inside, which is exactly what yoga is. And what's great about what they've done is that they have this wonderful prescription and kind of like a closing set, right? They don't know which aspect of it, but they kind of have a closing set where this is the prescription. It's an 8-week prescription. And that's one of the areas that I think that yoga therapy could really benefit from, is having at least what are the very basic things that you must have in your yoga prescription.
And until we have this kind of data to support it, this evidence-based medicine to say, here's your closing set, you need to do XYZ, and everyone who has cancer should be practicing this closing set. Are we doomed until we have that? Do we really need that data to get ourselves in the door firmly and spread throughout every hospital in the US?
That's so funny. I always say, like, do we really need to study the microbiome to that extent to just know that we were supposed to eat an apple a day? Because we've known that we were supposed to do those things. But, you know, sometimes I think that all these little puzzles on this planet for us to try to figure out in case we feel like we really have to control these things, and we can keep going and going and going. And there's going to be more and more data for us to get. And there are some things that we know are important. Mind, body, spirit, health is important. And feeding your body healthy food definitely reduces your risk of hypertension and diabetes and improves your long life. Do you need to do yoga? Not necessarily. You could walk and meditate at the same time. You could walk, and that walking is one of the best things that you can do for yourself. But if you do it while you're talking on the phone yelling, you probably don't get the same benefits that you would if you were maybe noticing a beautiful color or a beautiful smell as you're walking. I think the research will be beneficial for a few reasons. To define that closing set, to make sure that patients aren't vulnerable, patients are not being pulled into, and this is where I do worry a little bit, things that aren't necessarily helpful, because I do think there are some safety issues.
Yeah.
And so I think that's where research could be helpful. I think best practices, we are evolving and learning that things are helpful. So for instance, pranayama, certain pranayamas may not be appropriate for people, in learning yoga therapy and learning maybe a patient with underlying anxiety doesn't do well with certain kind of pranayamas. Those kind of research would be helpful. And then money and like supplements, like yoga-like supplements. So people want control over these uncontrollable outcomes. And where yoga can really benefit somebody is, as you just said, it was free what you did. You relaxed into things. You relaxed into the philosophy. Feeling like you need to control your outcome could potentially look like, I'm going to get an energy healer. I'm going to have this person be my guru and I'm going to pay them to do this. I'm going to take these supplements. And that's where I guess research is important. And on one more thing, for the wonderful people who are providing this work, who do deserve to be paid for what they're doing, I think just like physical therapy, just like acupuncture, just like some of these things, we need to prove to the people who fund these things in order to get reimbursed. And that requires some consistency.
Yeah.
And reproducibility.
And that may be the bottom line, that in order to get people in here to do the work, there has to be at least some basic data saying it's worth the money.
Yeah. And we've got that, I think, for anxiety and depression right now, although it is primarily in breast cancer patients. I think that there, in terms of cancer data, there's definitely data outside of cancer, but I think that at the very minimum, for us not to recognize the importance of calming the brain and calming the thoughts to improve quality of life and to help people be able to have a clear decision where they're recognizing the part that's causing their suffering. I want this. I don't want this. I want to live longer. But to kind of put that aside to make a clear decision when facts about efficacy are presented to them. That is work that there isn't really somebody available to them to do. We have psychotherapists and therapists in the hospital, but there are only so many. Yoga therapy could offer so much more. For instance, Smith Malaya and I are the SIO Yoga SIG co-chairs this year and next year. And we had a wonderful presentation from two of our members last month about the hospital that they work in and what they do as yoga therapists is they specifically are asked by a nursing referral in a chemotherapy unit for patients who are particularly anxious. The referral is placed and they meet with them while they're getting their chemotherapy. I can't even imagine how wonderful that would be and why every hospital doesn't have something like that. Yeah. And the fact that that's usually paid for by philanthropy is so limiting. Can you imagine somebody sitting with you on your first chemotherapy appointment and teaching you how to breathe and how to engage your autonomic nervous system, how to override your autonomic nervous system and shift it? Just powerful things that, yeah, I know they're already good.
And even the co-regulation of having someone there with you, a helpful, kind person sitting with you, in addition to all the yoga techniques. I mean, it just seems like a no-brainer.
Yeah, therapeutic alliance with somebody. Yeah.
Well, Lois, you have given us so much to think about today. Is there any last thoughts that you'd like to offer to us, or do you feel complete?
Actually, I feel pretty complete. I think there is so much more we could talk about. I think there are yoga therapy and yoga in general has been so beneficial to me. One of the things that I love about it is that I don't always get to give. It's a little selfish, be honest. I actually don't usually get to give good news. And helping somebody move through those koshas to feel physically good, energetically good, to quiet their mind, and to feel that little bit of bliss is priceless and something that I really enjoy being a part of, so that I can go into the next room feeling energetic and fulfilled and being able to offer people what they need.
Well, thank you, Lois, so much for being with us today. It's been an honor and a pleasure to be with you. And thank you for all the good work you're doing in the world, both as a medical doctor, as a yoga therapist, and a researcher. It's great to know that there's people like you out there.
Thank you. Thanks for the opportunity to talk.
Thank you so much, Doctor, for being with us today. It's really interesting to listen to you and to really hear what it means to have great research and evidence-based medicine. And it's also interesting to hear you say that on one hand, yes, we really need this data and this research to kind of show Western medical what it is we can do. But on the other hand, it's also such common sense that it's hard to go through all of this, getting funded, collecting the data, analyzing the data, putting it out into peer-reviewed research journals. There's a lot of work to do when we already know that really good lifestyle medicine and the basics of moving your body and breathing deeply and meditation, we know that works. That data is kind of already there also. So it's interesting. I'm involved with a study for many, many years now at Wake Forest University looking at cancer care also. And it's just amazing to me how many millions of dollars it can cost to do a really good study. And then how each study has to be, staying within these certain categories and these bounds. And you can't do any of this and you have to do more of that. And it's very, very strict in order to get the data that we really want. So this data is coming. The problem of if a study like this gets funded, how is money going to be made off those results? It's not like a drug that you can now go print more of the drug and make money off of it. So it's very, very complex, but I think it's coming. I think there's already a lot of great data and research out there. It just takes time and money and effort to make this happen. So the last thing I want to share with you is that here at Optimal State in August, we have a whole month of group yoga therapy clinic on cancer care, whether it's preventative, you're going through it, or you've already been through it. We are a wonderful community that will get together for the month of August, 4 different times on Monday nights to basically delve into yoga therapy and cancer care. It's experiential. There's a portion where we do the postures and the breathing and the meditation. And then we follow that up, if you'd like to join the second part of it, for continuing educations, where we have a discussion about why we did what we did. So I'll put that in the show notes, and we would love to see you with us for the month of August here at Optimal State. All right, everyone, have a great week, and we'll talk soon. Thank you for listening to the Yoga Therapy Hour podcast. We want to remind you that you can always go over to YouTube and see the video versions of almost all the podcasts. However, we do reserve the most recent video production for our Patreon members. Our Patreon members help to support this podcast, and we'd love to invite you to be part of that community also. They get free gifts every week, yoga nidras, and all the newest content before it comes over to YouTube. So find us on Patreon. It's the Yoga Therapy Hour and Optimal State, and we'd love to have you support the show. A special thank you to our team here at Optimal State. We are truly a global family. George Mantuan, one of our executive producers. Adam Satchel, senior media producer and sound engineer from the Philippines. Krishna Panchal, a producer from Canada. Modupe Abdullahi, who does the show notes and is an editor for us from Nigeria. And Peter Morley, who wrote and produced the music for this show, who lives in Australia. Find more about Peter's work at www.zenmusic.biz. Thank you for listening. We'll see you next time.